Melbourne woman has been forced to drive her elderly father to hospital while he suffered a stroke as the state's health system buckles under pressure. Julia Bradley's live from Melbourne. Julia, what are health workers saying?
Well, health workers are continuing to speak up about the deteriorating conditions within Victorian hospitals. We haven't even reached winter yet, and already there's significant pressure on the system because of a shortage of staff and a shortage of beds. There's been a rise in influenza cases, and of course we are still dealing with COVID as well. Just within the last week, we've seen ramping return to many of our major hospitals, including here at the Royal Melbourne. And there's also been a code red that was declared for Victoria's ambulance service on Friday night. And that was because of a technical issue within Victoria's 000 service known as Esther. And it meant that operators then needed to use a pen and paper instead of the system. And 70 people were reportedly waiting for an ambulance to arrive because of that technical issue. A shortage of staff, a shortage of beds. It's a perfect storm. It's not just affecting the city, Tim, but also the regions, with reports suggesting that ambulances weren't able to be dispatched in both Shepparton and in Bendigo on Wednesday night. And we've also heard from a woman who was forced to drive her elderly father to an emergency department after he suffered a stroke.
I just did what I had to do. I just didn't want to wait. They can't even get into emergency or into triage and stuff like that. So that's why I just thought, you know what, let me just bring him in myself.
Clearly there is no quick fix to this, but there are calls from health workers to find urgent alternative accommodation for hundreds of elderly patients and some disabled patients as well. They say that this could free up a lot of space in our hospitals if they are able to just dispatch some of these people and get them over to a different accommodation instead of taking up beds at hospitals.
Absolutely. Thank you, Julia. Appreciate that.